Hope is alive. Thank you for joining us today. My name is Eve Moffitt, and this is my co-host, Kay Gibbs.
Good morning.
And Hope is alive. It's about the setbacks, disappointments, hardships, and then adversities that some people have to go through. We have today an expert rather than somebody who's gone through adversities. We have someone who has chosen to help people with adversities. Today we have Stacy Holyfield. Hi, Stacy.
Hi.
And you're going to tell us about speech therapists. Stacy became a speech pathologist, and I want to know why she did.
I just finished my program at NAU, and I'm entering the field of speech-language pathology because I wanted to be able to work with people who have different neurological impairments. Also because it's such a large scope of practice, so we also get to work with people who have voice impairments or language development, kids who have language development things. It's a really large field, and it's very interesting, and all of it entails getting to help people.
Yeah, so. That's good. You had your father had some speech impairment.
Yes, my dad has a traumatic brain injury, which results from a blow to the brain. His was caused during a motorcycle accident, and so my dad often struggles with being able to retrieve words when he's talking. We're going to talk a little bit about that today.
Yes.
And so
yes.
He was a little bit of an inspiration to me as far as becoming a speech therapist as well.
Yes, he's undergone speech therapy for how long?
He had 4 years, the most recent 4 years of speech therapy, which has his injury is over 30 years old. And
so
he made...
you can reclaim even way down the road,
yes.
It's effective to go into therapy.
Yes,
Oh.
Yes, he made many gains within 4 years of speech therapy.
There's a word of hope right
yes.
there.
Yes. What is aphasia?
Aphasia is a language disorder that is caused by damage to the brain, which can be caused most commonly by strokes, but also from brain injuries, like a blow to the brain, or even brain tumors or infections that cause the brain to swell. Mm-hmm. And the damaged area would be impairing the language centers or the areas of the brain that help with being able to understand language and formulate language, and that includes reading and writing.
Oh, reading and writing. Oh.
So aphasia can occur quickly within moments of having a stroke or a brain injury, or it can occur more slowly or progressively with a tumor, a brain tumor.
Yeah.
If the tumor is growing.
So. You said stroke. Will you explain what a stroke is?
Yes, I will. And I have a picture with me today, too. So a stroke is a sudden interruption of blood flow to the brain, and the nerves and the cells in the brain need blood because the blood supplies oxygen. So if the brain is deprived of blood, then the cells are deprived of oxygen, and they are unable to, they don't stay alive if they don't have that constant flow. So a stroke is death of brain cells because of a block of blood to the brain or because of a bleed on the brain. And those are the two different types of strokes. Ischemic, a block of blood flow to the brain, or hemorrhagic, being that there's an artery in the brain that burst and bled or caused pressure on the brain.
Yes.
Did you want me to show a picture?
Yes.
Here? So I did bring this picture just to show a gentleman here with arrows kind of pointing to the brain, and you can see a little, the picture may not be that clear on the camera, but there is a little blockage here which prevents blood flow to some of the language centers in the brain. And so this gentleman would have a stroke that would impair his language.
Yeah.
And so...
Well, who gets aphasia?
Okay, who gets aphasia? So anybody can acquire aphasia. Aphasia, again, because of the causes, anybody who has a brain injury or a stroke can experience aphasia if the language centers in the brain are affected by that brain damage. So,
yes.
There are different kinds of aphasia that we can talk about as well.
Yes.
And so individuals who have an aphasia that we call non-fluent it's characteristic of a very halting, effortful type of speech where the individual knows what they want to say, but they're unable to find the word that they need to say. And they also, the language is very agrammatic, or they might not use words such as is and in. Instead, they might say walk dog instead of I want to go walk the dog.
Almost going back to a childhood beginning of speech pattern.
Their sentences
very simple and
it's
direct.
Yes, it's more simple and direct. Yes. So and it's frustrating usually for people with a non-fluent aphasia, or especially we call that in our field of speech pathology Broca's aphasia.
Okay.
That can be very frustrating because they do understand the language that they're hearing, and so they can have difficulty being able to communicate expressively, but they're understanding receptively.
So it is not affecting intelligence.
It's
just the transferring that they can't get out.
Yes,
they're cognitive, but they're not able to vocalize. Is this what I'm saying?
Yes. So what we're kind of talking about two different things. So with the intelligence factor, it's definitely possible that areas of the brain that are affected are just the language areas, and other areas that affect cognitive skills are left intact.
Oh, how frustrating.
And so that can be very frustrating for somebody who has a Broca's aphasia. They definitely know what they want to say, and they're very intelligent, but they have difficulty finding the words that they need and putting it into fluent sentences.
I imagine they also suffer judgment from people from the outside, seeing that maybe they're not intelligent anymore,
yes.
or they talk down to them, or they dismiss them.
Or they finish the sentences for them.
Oh, you're both right on. In fact, one of the things that speech pathologists try to do in therapy with their patients who have aphasia is help them to tell their families, or retrain families to know skills, things that they can pay attention to, such as don't finish your loved one's sentences, understand that they know what they want to say, and give them time to say it.
Patience, yeah.
Yes, and also include them in conversations, because if they have difficulty finding words, they can kind of become secluded from the conversations just because, they...
I've seen that. They talk around them like they're dead, or they're in the other room or something.
Yes, and so it's
insulting.
important to bring them in, because that's more socially fulfilling for everybody.
Yeah. What's another type of aphasia?
Another type of aphasia is Wernicke's aphasia, or what we call fluent aphasia. Often with Wernicke's aphasia, it's the area of the brain that is affected can also mean that they don't understand the language that they're hearing. And they may not know that the language that they're speaking doesn't make sense to other people. They know what they want to say, but it's coming out in words that don't make sense. And so Wernicke's aphasia we call fluent, because people with this aphasia speak many words in very fluent sentences with normal types of speaking. We call it prosody, but that's the emphasis.
Patterns.
Yes.
Yeah.
Inflection's a good word. And yes, so this type of aphasia, the speech may sound normal, except that it doesn't make sense to us. And they may not know that it doesn't make sense. So they might feel frustration because they're telling us something, and we're looking at them with a confused look.
Oh.
We don't know what they're saying. And it's coming out. Often the words might be not a real word, like snoodle or something, they might say. And then their grammar might be off as well. So they might use just a lot of words and not in a disorganized way.
Yeah.
So
Jabberwocky.
Jabberwocky.
How's your Wonderland? Jabberwocky.
Yes.
Yeah.
But not a laughing matter.
No, it's frustrating as well for them.
Yes.
But less frustrating so because they're not as aware of that they're not communicating what they think that they're communicating. So, and I wanted to show in the picture too that non-fluent aphasia or Broca's aphasia. Oh, thank you. Non-fluent aphasias are often caused more injury in the brain is more in the frontal area, And so I don't know if this comes out as clearly, but in the frontal area, the Broca's area is more frontal, whereas the Wernicke's aphasia or the fluent aphasias affect more of the auditory comprehension in the temporal lobe.
Wow.
So those are the types of aphasia.
Yes. Yes. Is your memory affected by the stroke?
Memory is also a cognitive function, and so yes, memory can be impaired, as any cognitive function can be impaired when that area of the brain is doesn't receive the oxygen that it needs in it.
Explain
dies.
cognitive to me.
Cognitive functions are things that require processes. So language is a process. Memory, attention, paying attention to something or being able to divide your attentions, sequencing, categorizing, organizing, problem solving. All of these skills are done by different areas of the brain, and if blood flow is blocked off from one of those areas, then that area can be impaired after a stroke.
I've heard that attention to a patient as soon as possible makes a greater recovery more possible.
Yes.
Is that true?
It is very true. We find that often many of the gains that are made in therapy after a brain injury or stroke occur in that first year, and often it can take up to 2 years of therapy to kind of recover some of those language skills or help to introduce new language skills. But the immediate care, when a person first discovers that they have a headache, a very unusually bad headache, or sudden slurring of speech, or sudden loss of vision, or weakness in one side of their body, it's very important to get immediate care. There are different things that they're able to do now right away to help decrease the effects of a stroke.
Yes.
When my mother suffered her stroke decades ago, it was just to sit and wait and see. There was no invasive or any treatment. You went to the emergency room and they just sat there and waited to see what happened. And
yes.
it's, I think, radically different now, is it not?
Yes, it is.
So as soon as possible, get help.
I think that reminds me of something I know of Eve and about her personal story with a stroke.
Yes.
Eve, maybe you want to highlight about how you responded to your stroke.
Well, it was on Christmas night, and we had a good Christmas. And I went to bed, and during the night was when my stroke occurred. And I got up the next day and did nothing, and the next day did nothing. And then finally, I was talking to someone on the phone, and I guess I wasn't making much sense. Mm-hmm. And they suggested that I go to the hospital. Mm-hmm. My husband had encouraged me to go to the hospital, but I said no. So when we went to the hospital, they did the tests, the MRI, and they did all kinds of tests. And the doctor came back and told me I'd had a stroke. And I still didn't get it. I didn't understand what he was talking about. Mm-hmm. And I was smiling, yeah. But then he said, we're going to keep you. Then I knew something was wrong. Mm-hmm. But my insight was off, mm-hmm. Because anybody, if you're not able, if you're slurring your words, you're dragging your foot, and your husband has to take you to the bathroom, would know something was wrong. Yes. But I did not sense it, mm-hmm.
Or were you in denial, Eve?
I don't know. I don't really know.
Yeah.
But my husband, he faults himself for not putting his foot down and take me to the hospital. Mm-hmm. Stacy is my speech therapist. Yes. And we've been working together, and I have made some progress.
You've made great progress.
Yes.
Even in just the short time I've been able to work
Yes. With you. And my speech therapy has been of great value to me. Mm-hmm. Yeah. Yeah. But people, when you're stumbling with your speech and you can't talk, people think you're dumb or you're stupid. And everyone has a story, you know? And so after a while, after the stroke, when I came to Arizona, I had had my stroke 2 years prior. And I had gotten to the place where I didn't talk at all. And my husband did the talking for me. And then when I wasn't with my husband, words came out. And they didn't make sense, you know? I was able to finally get speech therapy. And I have just made inroads and just advances. Advances because of it.
Yes, speech therapy can help to help the person find out what their communication strengths are and use those strengths, the communication abilities that were not impaired by the stroke. But speech therapy can also help to try to regain language skills that were lost. Also, speech therapy can give an individual with aphasia compensatory strategies that...
Compensatory
to compensate. And so I think I know of a couple that you use, and so maybe you want to highlight those.
Oh, yes. One of my strategies is to stop, smile, breathe, and identify the topic. So if I am in the middle of speaking and I reach a spot where I don't remember the word. Now, in the past, I would try to insert another word. And it just took, right now it makes me tense, you know?
Thinking
and
about
then
it.
I stop, I smile, I breathe, and I identify the topic that I'm talking about. And it works most of the time. It doesn't always work, you know?
Yes, you can have many tools in your toolbox, and often it's finding the tools that help the most. But with some of the work that we do in speech therapy, we also help you just to recover language skills, and you speak with less, I've noticed, less moments of word finding issues. And I notice that they come out more when we do hard tasks such as timed tasks.
Yes.
Where we put this stress on. And that's another important thing about aphasia, is that it can occur more when the brain is tired and fatigued. And people with aphasia might recognize that they might have a more difficult time finding their words when they're very tired.
Yes.
Or after a long day of thinking.
Yes. My cutoff time is usually around 4:30. When I've had my day starts early. I'm up and I have a meeting I attend at 7 o'clock. And so I'm busy. My mind is working. And I am fatigued and just, that's it. After 4:30, blank. I go to bed. You know, I lay down and I rest. But the thinking process is over. The talking is over. I'm tired.
Yeah.
I've seen a big change as a result of your therapy, because I met you about a couple of years ago. And you were very quiet and you were very reticent. And it was in a group where she was under pressure to do some reading on occasion. And sometimes she'd hand off and have someone else read it. Or she'd almost apologize, I'm not talking well today, and then she would go ahead and because of the stress, would kind of stumble around. Well, hard to believe, isn't it?
It is.
It is.
Yes.
In 2 years. The remarkable advances she's made. And confidence.
Confidence. What I receive from my speech pathologist is confidence. You know, that's a big part of it.
Knowing that there are things you can do when you can't find the word that you need, and also just being able to actually recover some of those skills makes a big difference. Yeah.
Do you have a particular, a patient that you want to tell us about?
A recent experience that I've noticed with one of my patients, she has fluent aphasia, so often she'll say a lot of words and I won't understand what she's trying to tell me. And so we use strategies to help her parse out and use very concise words to help explain what she needs to say. But we noticed recently, she actually came to a therapy session. She was saying a lot of words and I wasn't able to understand the meaning of what she needed to tell me, but she was very frustrated. So we used our therapy session hour and she arrived late. And so I think I was able to gather that she was frustrated because of something that made her late, but I didn't know her story. And so we sat down and spent the time using her strategies. And it took the better part of an hour because of the amount of words that she wanted to be able to say and her level of frustration. But by the end, I was able to determine that, and she was able to say that the driving service that picks her up to bring her to therapy had called her that morning 15 minutes before they were supposed to pick her up. And they said that they would be late. And because of her expressive language impairment, she was unable to tell them, please try not to be very late. It's very important to me to be on time to this, to my speech therapy. She wasn't able to say any of that. All she could say was, okay. And that was very frustrating for her to not be able to express, this is important to me. And so she said, not only did they call 15 minutes before they were supposed to pick her up, but they were almost an hour late picking her up.
Wow.
And so she missed most of her session, and she wasn't even able to tell them when they picked her up, this is very frustrating for me. Yeah. She wasn't able to communicate that. And so we were able to use our session to first be able to identify what her frustration was and then write a little letter to the company so that then that could be expressed. And that's what she needed. She needed to be able to express that. And I thought
Get the support.
Yes. And you could see just a sigh of relief when somebody else understood her frustration. Because of her impairment and the severity of her impairment, she's used to not being understood. And that's why speech therapy is so important to her, because she's learning the strategies. We all have that innate need to be understood.
Yes.
And so that's a good story.
Yeah. That's a very good story.
Good story. Thank you.
Mm-hmm.
Thank you.
Recently, my insight, which was affected by my stroke, was, and you helped me. I was talking to Stacy, and Stacy says, "Has anything happened?" I said, "No." And then as an afterthought, I related that I had fallen down at night, and I had been passing out, and I wasn't conscious.
You told me you woke up on the floor.
Yes, I woke up on the floor, and my jewelry case is quite large, and I had knocked the jewelry on me, and my husband came into the room, and he says, what's, and he got me up, and he put me back to bed. I thought it was my medication. And so then it happened again, and I was on the floor, and I'd hurt myself, and I'd broken my jewelry case, and I'd gotten back in bed, but I took it as I forgot about it. And so I was telling Stacy, because Stacy, I don't know what it was you asked, but you got it out of me, and you said, well, Eve, that's serious.
When you wake up on the floor after having lost consciousness, that's serious.
One would think.
Yes.
But my insight was affected.
Yes. Yeah.
And you pointed that out to me. And so then I made my appointment. I got to thinking. I was thinking, I'm having TIAs, And what are TIAs?
Transient ischemic attacks. Those are what we often refer to as mini strokes, where the blood supply is cut off temporarily, so it may affect language for a couple of hours up to a day, but it doesn't. The language is usually recovered within that short period of time.
Yes, and so I went. I made the appointment with my neurologist and MRIs tests. And she told me what was wrong. But without you and haven't talked to you, because I wasn't going to tell anybody else. It was just, and this could have continued.
Yes, yes. The fact that you had told me in passing made me realize, well, insight is the ability to understand what will keep you safe, or what, those things that are important to follow through with. And if you're not recognizing that being unconscious and waking up on the floor isn't, then that's definitely an important thing to address. And often, in Eve's case, just making her aware of that. Now, I think you'll think that through. If something happens again in the future, you'll say, well, maybe I should go see the doctor. Because you didn't after your stroke, and then you didn't after you had 2 incidents, and I think you said they were 3 weeks apart? And
2 weeks apart.
2 weeks apart. So you woke up on the floor the first time, and then 2 weeks later it happened again. And in both times you didn't realize that you should follow up with your neurologist and make sure that you were doing okay and that there wasn't...
At least she's consistent.
That's true. Hopefully she'll stop being consistent in that area now. So.
Yes.
Eve.
Oh. Yes. Aphasia. It's really something.
It is.
My mother suffered aphasia after her massive stroke. She went into a Spalding unit, and they had to teach her to swallow, to sit, to everything. And they were an incredible unit, intensive work. And there was no time for her to go into denial. They kept her busy with therapy. She ate with other people. There was no hiding out. And so they were really tough guys. But in her aphasia, she would look at me and she'd say, oh, the neighbor's driving a new cornflake. And I'd say, well, Mom, I don't think so. But I wouldn't give it to her. We would, with humor, come around to Cadillac. And one other time I was going to the store and I said, Mom, can I get you anything? And she said, yes, please bring me a tooth fairy. And I said, well, now, I think they're all out of tooth fairies. But is there something else that's kind of like a tooth fairy? And we would work through it. And it got to be kind of a humorous thing instead of an insulting or embarrassing thing. And so we learned together to treat it with humor, which just really helped the whole situation. It did not become tense and awkward, And so she lived 17 years after a massive stroke, and she was indomitable. I mean, she just kept going on. I
like that story because the most important thing that I think of when I'm working with patients with aphasia is that I want their lives to be fulfilling. And your mom was able to enjoy her life with you and to use good humor when the language impairments came into play while she was talking. And those kind of things are kind of what make what I do fulfilling.
That's good. Well, you're great at what you do, and you made a great guest.
Oh, thank you. It was such a pleasure to come here and talk with both of you today.
So informative. Thank you.
Thank you very much.
My pleasure.
Well, thank you for joining us for another edition of Hope is Alive, and Hope is Alive. And take care and smile.
Feels like nowhere to run to, there's nowhere to hide. Don't let fear overtake you. It's time to decide that you'll never give up, never give up, never give up. Never give up, never give up, never give up. Never give up, never give up, never give up. Never give up, never give up, never give up. Don't waste another moment on fools and things that keep you down. They can't or won't change, but you can. You can turn your life around. We all have made mistakes.